Hey everybody, happy Sunday. It's Cheryl. Welcome to the channel. If it's your first time, I'm so glad you're here and I hope you come back. I also hope that you find the information very helpful and that you'll subscribe to the channel and leave me a nice comment. Those of you who are part of my 351 subscribers now, I appreciate you so much. I really, really do. So we're going to go ahead and get this video started because I don't want to make it very, very, very long. But I wanted to get back to you on the shingles and the postherpetic neuralgia that happens after you have shingles. So let me explain to you a little bit about what it is and what we can do about it. Okay, so postherpetic neuralgia is actually nerve pain that you experience after you've had an outbreak of shingles. What's happening is your nerves have been damaged. This is a nervous condition or a nerve condition. Those nerves that are damaged normally send messages to the brain, but now it's confused. And so rather than it sending the right message to the skin from the brain, it's now causing confusion in the messages and it's causing pain. And this pain can last up to a year. In my case, what am I, in the 8th month? Mine started in March. It's now November. So I'm thinking it's probably going to last at least a year, or if not, I will be having reoccurrences of this for the rest of my life. Okay, so you can experience pain, itching, aching, kind of like arthritis, I guess, and you never know when it's going to hit. Okay, and so if you're over 50 like me, you have a higher risk of getting this when you have shingles. Or if you have a medical condition, if your immune system has been compromised, such in a cancer patient, you have more of a chance of getting this postherpetic neuralgia. And I have a very dear friend who is doing just that, battling cancer, and she and I both have the same thing. What I want to talk about today is how we can treat this. There are medications, but I am more on the natural way, a natural way that we can treat this pain. And so we're going to talk about that a little bit today. And I do have notes here, so I'm going to be reading these notes, and I don't want to leave anything out, okay? And so if you see me looking down, that's exactly what I'm doing. I'm reading some notes that I've taken here. So one of the things that you can do if you're experiencing this postherpetic neuralgia pain is a warm bath. Baking soda added to your warm bath or oatmeal will help to reduce the severity of the pain that you're experiencing. Surprisingly, 1 out of 5 people might get this. I'm always going to be in the one the number, whatever it is. If it's 1 to 100 people, I'm going to be in the one that get it. That's just what I've experienced over my lifetime. Okay, so in addition to the warm bath, you can also use essential oils such as lavender or chamomile. They can be diluted and applied directly to the pain area, the area that you're experiencing the pain in. Okay, now, what should we be drinking? Not Pepsi. That's my bad vice, as you may say. Pepsi, oh my goodness. A Pepsi put in the freezer until it gets cold enough where the ice just starts to form. I love it. But I have cut them out. I was drinking them pretty regularly, and now I usually have it on the weekend. Um, I may have one, and then I will drink half of it, maybe one day, half the next. And then I try to steer away from that because I noticed when I would drink it, I would get pain. I said, wait a minute, this Pepsi is causing this pain? It's sugary. Anything that's sugary. Baked goods, pies, cakes. Um, and I mentioned in my last video on shingles, they even listed white rice. So it kind of sounds like carbs, but we know they're healthy carbs, like our vegetables. And so we're going to talk a little bit about food in just a minute. So stay tuned. Um, what should we be drinking? Water. Water. And I'm guilty. I am not a water drinker, but I am definitely trying to improve in taking in water. Now, let me tell you what this water will do. Believe it or not, it reduces the nerve stress. It will help your muscles to relax. That means reduced pain, healthier nerves, and faster recovery. I should have been drinking this water months ago, but let me say this. When you research this, and this is what I want you to do, I want you to go on Google and I want you to research this information for yourself. I also want you, as you are researching this information, do not read one thing and think that's it. Read multiple articles on this because one article will give you just the basics. Another article will give you what you can do about it. Another article will tell you what not to do. So you need to read all of it. That's what I had to do in order to comprise this information that I have here today. So you want to keep yourself hydrated with water. It doesn't mean you can't drink other things, coffee, tea, whatever, but try and keep your sugar content down and try to stay hydrated because this water will feed your nerves. Who knew, right? Okay, the second thing, what about a vitamin supplement? What can you take to help with this postherpetic neuralgia? Okay, B12. That's going to feed your nerves. And it may reduce the need for you to have to take an aspirin if you're in pain or ibuprofen, whatever your choice of pain reliever may be. It said in a study of patients who were suffering from this pain or itching, those experiencing pain were shown to have a deficiency in B12. Okay? So I had decided before I even read this information, when I first discovered it was a nerve problem, I knew I needed B vitamins. And so I started doing that. Now, I'm an off and on person, but I started doing that because I thought, okay, I need to feed my nerves. And we know that stress triggers this too. There are other vitamins that you can take that will help these nerves. Let's look at it. Magnesium, vitamin B12, alpha lipoic acid. I have no idea what that is, but you can look it up, okay? Omega-3 fatty acids, B1, B6, and vitamin D. All of these maintain and support your nerve function. What about foods? Fruits. Okay, berries, peaches, cherries, red grapes, oranges, watermelons. All of these things are loaded with antioxidants, which will decrease the inflammation in your system. Grapes, blueberries, cranberries are full of anti-inflammatory compounds. Okay? Wow. Don't that that sounds wonderful, doesn't it? Okay. What about some chocolate? Yeah, you can have some chocolate. Listen to this. Dark chocolate will benefit your nerves. It's rich in flavonoid compounds and antioxidant properties. It will reduce inflammation and improve the blood flow to your nerves. That is quite a list. Now, you may be thinking, how in the world can I get all these foods into my diet? Smoothie time. It's smoothie time. Get your favorite fruits, drop them in a smoothie and some milk, water, juice, however you want to take it. And this is called superfoods. Put it in your daily routine. Have one in the morning. I was drinking smoothies. Um, I was doing strawberries, bananas, protein powder, and I wasn't adding a lot of fruit because some fruits that I'm allergic to, okay? Let me just put it like that. Especially if they have a lot of acid in them, they will break me out. Um, Strawberries and I do not get along, but I eat them anyway. Okay, so you can have a green smoothie. If you want to do spinach and kale, you can add some berries to that and add some flaxseed. Um, if you're a snacker, try and replace those with fruits and berries. A handful of almonds and walnuts will be great in healing your nerves. Okay? And one last thing that I want to bring out that you can add to your diet if you're not already consuming these are salmon, mackerel. These have your omega-3, and your body needs this to repair your nerves. Okay? Why food matters. And I'm going to kind of read this. I'm not going to read it word for word, but I want you to get every word of what this is saying, why this food is so important. Our nerves are complex and sensitive, meaning recovery can be slow when they get damaged. However, with the proper nutrients and lifestyle choices, you can give your body what it needs to heal, along with consulting nerve pain specialists if you choose to do so. These foods can be crucial to your recovery. Eating a variety of antioxidant-rich and anti-inflammatory, nerve-supporting foods can reduce pain but also promote long-term nerve health. A diet rich in these nutrients supports your body's natural ability to repair itself, giving you the best chance at recovery. If you're suffering from nerve damage, consider this your sign to take action. Healing starts from within, and these foods on your side, you're giving your body a fighting chance to bounce back. Okay, so if you're suffering from postherpetic neuralgia, like I am, I hope that this information will help you. I had no clue until I really, really researched it. You know, I went to the doctor. He said, oh, you've got postherpetic neuralgia. Here's some patches for the pain, and you can take gabapentin, which I decided not to take because one of the side effects was suicidal thoughts. I didn't want to chance that. And so I forego that's not the right word, but I chose to forego the drug. But look at all these other wonderful things that we can eat and feed our body. Things we probably need to be eating anyway. So I'm going to let you guys go. I hope this has helped you. I hope you come back. I hope you subscribe to my channel. And I wish you long life and great health. God bless you, and I hope to see you again. All righty. I'm Cheryl. I'm signing out. Bye-bye.